You're listening to the Health and Wellness Podcast, curated by Dr. Lori Marzell. Dr. Marzell is a primary care physician that combines the wisdom of natural medicine with modern medicine to help facilitate the body's inherent ability to restore and maintain optimal health. She focuses on evidence-based nutritional therapy for food allergies and in bioidentical hormone replacement. She is a twice published author, a long-standing member of the North American Menopause Society, and a certified menopause practitioner. We are on a mission to empower you with the knowledge and expertise that Dr. Marzell has earned throughout her career. We hope you enjoy and want to thank you for being with us today. Without further ado, here's Dr. Marzell. Enjoy the show.
Hi, I'm Dr. Lori Marzell, and today I would like to talk about food allergies, or how to make peace with your body at last. Now, a lot of people aren't that interested in food allergies, and why is that? Because they think food allergies are a rare occurrence when someone is very allergic to peanuts, and they get transported to the hospital if they have peanuts and have to be treated in the emergency room, and then they get rescued and then they're okay. But most people don't have those type of severe reactions to foods or other things. So people aren't that interested in it. Well, it's out there a lot more than you think it is. As a matter of fact, it is lurking in I would say most of the people who are out there probably have some food allergies. How can you tell if you might have food allergies? Well, if you have other allergies, that's a good clue. People who have environmental allergies, they are allergic to grass or molds or flowers, or there's a whole variety of things. They usually have food allergies as well. And the reaction doesn't have to be so severe that people are getting transported to the hospital. There's a whole host of reactions that you can have from food allergies, and that's what makes them so confusing. So let's talk about that and get right into it. Attention deficit or attention deficit hyperactivity disorder is present in children as well as adults. Did anyone ever think that that may be related to a food allergy? It is. Believe me, I used to treat a lot of kids with this, and I would test them for foods. If they ate the foods they were allergic to, they would suddenly have, be running all over the place, out of control. And because this is a reaction to something, it's not like you can discipline a kid at this point. You can't teach them. Really, their brain is not working very well, and you have to wait for the brain to return in order to, discipline or talk to a kid or teach a child. So I've treated many children by investigating if they are allergic to any particular foods, finding those reactions, taking the food out, substituting other foods, beefing up the immune system, and they do really well without any drugs. The problems with treating children and adults with these kind of problems is that the drug may make them easier to function, but it doesn't take away the allergy, it doesn't take away the reactivity, and it doesn't take away the many side problems in their body that is coming from that reaction that is being ignored. Food allergies can affect moods. They can cause depression, anxiety, and anger. Food allergies are also associated with a whole bunch of inflammatory disorders. Here are some of them. Arthritis. Now, this can be autoimmune arthritis, or it can be wear and tear arthritis. It's an inflammation in the joints. Fibromyalgia is famous for having some food allergy component. Hives, eczema. If you have eczema that typically comes out on the same exact location, you can put some cortisone cream on it and it'll go away, and then it comes out again. There's something causing that. It's an inflammatory reaction from something you ate, usually, unless you can track down that you were touching something and then your hands broke out in eczema from touching a toxic substance that you're sensitive to. But if it's something you've had for years, it's in the same place, it's a food allergy reaction. Intestinal spasms, those are pretty evident. You eat something you're allergic to and it just wreaks havoc with your gut. GERD can be caused by food allergies, and any kind of inflammatory bowel disorder can be connected to food allergies. Another really interesting thing is recurrent infections. So let me talk a minute about this. These are things that just keep coming up again and again, like a recurrent gallbladder inflammation or a recurrent urinary tract inflammation. Many times these recurrent infections are associated with something you eat causes inflammation, and it tends to settle in certain organs. By testing for food allergies and eliminating them, you take the original inflammatory focus from establishing itself in that organ, and that gets rid of the problem. Food allergies cause inflammation, and inflammation causes pain. So a lot of different pain syndromes are associated with food allergies. The mechanism of food allergy reaction. Well, number one, it causes swelling. The body thinks that this food is a poisonous substance and it wants to dilute the poison. It does this by releasing histamine and causing swelling in the tissue. I remember I had a patient who was allergic to coffee. Every time she drank coffee, she'd swell. And I used to be, she had back problems as well. And one time I was working on her back and I was examining her back and pushing around. And every time I put my fingers on different spots on her back to see if she had pain, the imprint of my finger stayed there. And I realized, and I thought, why is she swelling? Where's this swelling coming from? And I'd say, well, have you had coffee lately? I'd hear the ominous silence of a patient who is not compliant. Swelling comes from food allergies. Also, if the body can't get enough to dilute the poison, it tries to kill it. It actually produces antibodies to the foods involved, which hook onto the parts of the food, and these antibody-antigen complexes can settle and cause more inflammation. They can settle in places in the gut, and they can settle in joints. So that's the deal with that. There's different types of food allergy reactions, so let's talk about that. An acute allergy reaction is really easy to see. somebody eats something and they sneeze or they cough or they have problems, they go outside and they roll in the grass and develop hives. It's an acute reaction. It's easy. It's there. You know the impetus that caused it. Not so easy are the chronic reactions. And with food allergies, it takes 5 days to totally get that food out of your system. Food allergies are oftentimes people's favorite food. So if they're eating that food, let's say somebody's allergic to wheat. Every morning they have toast, and then they have a sandwich for lunch, and then, and that goes on day after day after day. So they have a reaction, but it's there all the time. So it's not identified as having a particular impetus. It's just always there. And these are the tough ones. Now, sometimes with children, you'll have them where they're very little and they eat something and they break out in a rash or they get diarrhea or something will happen. Oh, they are allergic to that. As they get older, this acute reaction. What do people do when kids have acute reactions? Do they take that food and not give it to them anymore? No. They keep giving them the same food, and then it turns into a chronic reaction. They say, oh, well, Johnny used to be allergic to whatever, fill in the blank, but now he's grown out of it. No, he hasn't. He has gone from an acute reaction into a chronic reaction. Chronic reactions are more difficult to determine where they're coming from. But that's what's happened. It doesn't go away. Reactivities to foods are they're coordinated through the genes within the immune system cells. Those genes don't change. Once they decide there's a bad guy and they want to get rid of it and they produce antibodies against it, that doesn't go away. It may change the form of the reaction, but it doesn't go away. And this is, I think, one of the most interesting reactions that you can have to food allergies, the addictive phase. A lot of people don't talk about this. I think it's very, very important. Sometimes people will have the type of reaction to a food that produces endorphins. And the endorphins are the hormones that make you feel good and happy and love. So when these people eat the foods that they're allergic to, and they feel so good, then they'll want to eat them again and again. And pretty soon, these are a big cause of food cravings. If someone is getting an endorphin response from eating a food, you should not expect that. If you eat a food and you say, oh, that tastes pretty good, remember, it's just a food. If you eat it, it's like the most wonderful thing that you can possibly imagine in the world. Something is wrong. When I have patients come in, I usually ask them for a typical diet of a typical day, what they would eat, the breakfast, lunch, dinner. And then I ask them, are there any foods that you really crave that are your favorite foods? Well, a person who has food allergies and has addictive reactions to it will stop me before I even ask the question. Oh yeah, bread. Their eyes will glaze over. Oh, I love bread. Remember, this is just a food. but it makes it very difficult for people to give up these foods. And this has a lot to do with people who are overweight. Because they crave these foods, they're kind of out of control, like any other addict. There are ways that you can stop the addictive reactions, but just knowing that it's out there is really super important. Autoimmune diseases are usually associated with food allergy reactions. Rheumatoid arthritis, psoriasis, vitiligo is an autoimmune reaction in the skin. Thyroiditis is an inflammation of the thyroid. Pernicious anemia comes from an autoimmune attack on the acid-producing cells in your stomach so that your body can't absorb B12. It needs those cells to provide the acidity to be able to produce other things that grab that B12 and pull it across the intestinal border. So these different if you have an autoimmune condition, you usually have a food allergy. You can actually see what people with food allergies kind of, if they have physical characteristics, you can tell if they have food allergy reactions. Not always, but sometimes. And one of the biggest deals is dark circles under the eyes or puffiness. This comes from swelling. Sometimes the swelling is so profound that the skin actually overlaps over and causes creases. And I'll show you a few more pictures in a minute. These are called Denny Morgan folds, and that is from excessive swelling. There's not too many things that cause this. Here's some more examples of dark circles with these lines underneath the eyes. If you see that, you've got a child with food allergy reactions or an adult. Why does the body react this way towards a food? Well, it usually starts in utero. Oftentimes, mom has allergies and can send antibodies to the baby, kind of telling the baby's immune system, hey, if you see this, watch out for it, because this is bad. It doesn't send the food proteins through in utero, but the antibodies will go through and they can sensitize the immune system in its formation. Food allergies are associated with poor digestion. So if you are not breaking down things, it's hard to digest food, it's hard to absorb food, and just the fact that the immune system will react to bigger things like anybody else. I mean, who would you be most intimidated by? King Kong or a teddy bear? Well, when the immune system sees a big protein that did not get broken down and it snuck through and got into the bloodstream, that's part of how the immune system keys into something is wrong, we better destroy this. And once it has keyed in that protein sequence to its brain, which is the genes, you've got an allergy reaction that is going to happen every time you eat that food. So if your stomach doesn't produce enough acid in a lot of people with food allergies, if you don't have enough acid, that's where protein is broken down, and the acidity of the stomach also stimulates the bile and the pancreatic enzymes to further break down food so that you can absorb them. But if that isn't working too well, you're going to have problems. There are actual cells called eye cells. They are in the very first part of the small intestine, right adjacent to the stomach. And those eye cells, when you are eating, will send a little message over to your pancreas and say, hey, we're eating something, you better secrete some pancreatic enzymes and help digest and break this down. Well, when you have food allergies, it's very interesting because those eye cells die. They actually die. They are converted to the kind of cells like that are on your skin, protective cells, not helping with digestion, but trying to keep things out. The interesting thing about that is that if you take those food allergens away and help support your digestion for a little while, those eye cells will grow back and they will resume their function of signaling the pancreas to produce pancreatic enzymes again. Isn't that interesting? We talked about that. Here's an example of some of the most common food allergens. Dairy products, I think, are number one, partly because when children are very small, a lot of them are given cow's milk. It has a lot of very big proteins in it, sometimes a little too big and a little too difficult for a baby human to digest and break down. These were made for baby cows. And if things aren't properly digested with a baby, then you might have some problems that last throughout life. Also, we eat a lot of dairy products in this country, so there's multiple opportunities to develop an allergy to this. Wheat and gluten are another that tend to be, we eat wheat so frequently. And so that's another biggie. Tree nuts are very important in the allergy problem. Corn, yes. Eggs, we eat frequently. Garlic has a lot of things with volatile oils that are real smelly and stuff like that tend to kick off allergy reaction. Bananas, again, because kids are given bananas before their digestion is really ready for solid food often. Chocolate can cause problems, and yeast and molds, fermented foods. If you have a yeast allergy or a mold allergy, you probably have a sensitivity to some of the molds in your food, like fermented products. Soy sauce, Thai sauce. Most cheeses are made by adding mold to milk, so you have a double whammy. Testing is easier than you think. There's been a whole variety of testing throughout history, but now it's pretty easy. Here's an example of one lab, and they are they're doing a bar graph on different foods, checking for the amount of antibodies they are detecting in a serum sample. The higher the bar graph, the more antibodies are being produced. And so this requires only a serum sample to determine what kind of food allergies you have. That's the end of our presentation for today. Thank you for your attention, and I hope that some of it was helpful for you. I will be doing some more further follow-up recordings, so stay tuned. And again, thanks for your attention.
Thank you so much for listening. If you enjoyed today's content, please feel free to share with a friend and help us spread our message. If you'd like to learn more about Dr. Marzell, please visit our website at www.drmarzell.com. Until next time.